Welcome to Wemmer Family Orthodontics. My name is Dolores, and it's my pleasure today to show you our office and introduce you to our team that makes Wemmer Family Orthodontics the fantastic place to come for your orthodontic treatment. This is our reception area. This is when you first come in the door. This is what you see. We have an area for the children to play. We have our TV. And then, of course, the next thing you'll see or you'll deal with will be Samantha Griffin, who is always at the front desk.
Hi, I'm Samantha. When you call in, you'll be always dealing with me. If you have any questions or concerns or need any help with anything, I'm the person you talk to.
When you come in as a new patient, you'll see Dory Fowler. She's our treatment coordinator. She'll be the first person you deal with in our office after Samantha. And her room is right here. And this is Dory, and she'll tell you what she does.
Hi, welcome. My name is Dory Fowler. I'm the treatment coordinator here in Okeechobee. And I've been with Dr. Wemmer for a total of 18 years. When you come to your new patient appointment, you should plan on spending an hour to an hour and a half here. It's a very thorough exam. We'll start with pictures with a regular camera of your face and your teeth, and then we'll do a Panorex. That's an x-ray that shows all of your teeth in one shot. Dr. Wemmer will do his exam. He'll tell me some things to put up on the computer, and then when he leaves, you and I will discuss the treatment in total, and we'll go over the payment option so that you know what you're looking at as far as that goes.
And now we're going to meet Patricia Wemmer, Pat Wemmer. She's Dr. Wemmer's wife, and she's been in the practice since day one. This is Patricia.
Hi, I'm Pat Wemmer. I've been with my husband's business for 30 years, or however long we started out, possibly 31. We started out in an office in Okeechobee, across the street from where we are now, and it had pretty much drab decor. It was a typical beiges and creams and that type of thing. And then after a few years we got hit by two hurricanes. I'm sure everybody remembers Francis and Jean, and I believe it was Francis that took our roof and peeled it back all the way down 3 office buildings. So we lost everything inside, and from that point forward, when I decorated it, when we got the office back together and we were going to decorate again, I decided that we'd never have any more drab colors, so we did it all in purples and reds and oranges and yellows and every color I could possibly think of. After that, we moved to a new office and had this built. Our new building here was built, and I decided to continue with the colors over here. And this is our on-deck room. I had actually seen all of this done on the back of a carpet pattern, and I flipped it one day and saw how this was set up in the chairs, and we copied it for here. So it's all colorful. The kids can have fun. There's a game room there, and it's just been a real treat to be over in a brand new office that has more room, more technology, and just wonderful to work in.
So now we'll go to the clinical area where the patients that receive their treatment, and I'll introduce you to the assistants. This is Tiffany Hayes. She's one of Dr. Wemmer's assistants. You've been with him how long?
10 years.
10 years. And this is Edith McDuffie.
Hi.
How long have you been with him?
Probably 15 years, I would say, off and on.
Okay.
But I was back full-time 6 years.
And this is Misty McClanahan.
Hello, I've been with Dr. Wemmer for about 10 years. Okay, so back here is where all the action happens. We place the braces, do the adjustments, make the teeth beautiful, smiles. We assist the doctor. That's pretty much it back here in the clinic.
So getting your braces on is always a happy time in our office, and all your appointments are happy. We try to keep everybody ready to come here and happy to come in here. But getting them off is an even bigger celebration. So when you get them off, we often give balloons and a cup of candy, because you're not supposed to have candy when you have the braces on. So we reward them with that, and then they get to leave their mark on our office, and this is the way that we do that. After they get their braces off, we have them choose a color, and then we paint their hands with that color, and then they come in this room and they find their spot, their special spot, and they put their print on the wall, and then we put their name under it with only their first name and their last initial. And it stays here, and once we fill this room up with the handprints, we're going to overflow into the hall and continue it. And now I'd like to introduce you to Dr. Wemmer. He's in his office, so we'll go in here. This is Dr. Wemmer.
Hello. Welcome to our office. Orthodontics to me is a special part of dentistry. It's a very positive aspect. You can change people's lives. We see many of our teenage patients blossom after their orthodontic treatment is finished. In fact, we have a lot of adult patients. We probably have 30% of our patients being adults. Most people that are considering orthodontic treatment have similar questions and concerns. These would be quality treatment, what do the appliances look like, how uncomfortable will it be, how long will it take, and how much will it cost. When we selected our orthodontic treatment system, we selected the Damon system because they best address the patient's concerns. This is an example of an orthodontic bracket which is bonded to the teeth. This is a traditional bracket with an open slot. This is the arch wire, which is the force system, and this is the rubber module that ties the wire in. You can see there's quite a bit of friction and the wire does not slide freely. In the Damon system, we actually have doors that open and close, so we can lay the wire in, close the door. There's no need for the elastic tie anymore. And now we have a series of channels with the arch wire lying loosely in the center, and there's virtually no friction, so the arch wire can be very light and move teeth comfortably, quicker, and with less side effects. So that's an example of the Damon system bracket. Open and closed. Orthodontic treatment can be expensive, but we offer payment options such as outside financing, and we also offer in-house financing to make treatment affordable for almost any budget. So we're also proud to be involved in the community. They have given us so much and we like to give back to them. And Dolores May was my office manager for more than 20 years, and she has spearheaded our community participation. So I'm going to let Dolores tell you a little bit about what we've done in the past and what we like to do.
Wemmer Family Orthodontics is all about family and children, and we love to become involved with all of that. So that was our main concern, to get involved in the community with the events that went on. We started with the March of Dimes. That was my love. So I got the whole office involved with the March of Dimes many, many years ago. So we did the walkathons and fundraisers all the time. And then that eventually got us into sports. We did the recreational soccer and softball. We sponsored teams. We give to the football and the baseball at the high school. At Christmas, we sponsor several families that are down on their luck, and we get the whole family, we give them a Christmas. They don't know who we are, but we give them Christmas. We are their Santa's helpers, and we get them whatever they need. We get a list from Hibiscus House, and we sponsor several families. We also have started years ago with a scholarship. So we donate an amount every year. We either sponsor 1 or 2 kids that are graduating from high school for a scholarship, and that's been very important to us to make sure that we are involved with that program each and every year.
Now I'd like to introduce you to my partner and daughter, Jennifer Schoenfeld, and she has been with me since the year 2000. She also graduated from Eastman Dental Center, where I graduated from.
So I grew up in Okeechobee. I'm a graduate of Okeechobee High School, go Brahmins, 1989. Well, that just tells my age. And I grew up around dentistry. Never, ever wanted to be a dentist or an orthodontist. I worked in my dad's practice during high school, did front desk work and helped out, and I thought teeth were gross and who would want to do that. I went away to college, went to the University of Florida, and came home for a summer and needed a summer job, so they decided instead of doing front desk, they would teach me to be an assistant. And so they put me in the back, and I loved it. I loved the positive energy, seeing people getting their braces on and off, mostly off. Kids were excited. Kids that never really talked during their appointments were all happy, and moms were crying, and they were bringing my dad pizza, and it was just a really fun environment, very positive. And I thought, wow, I mean, he's not just giving them good smiles, and he's changing their lives. It was just a lot of fun. The whole team, it was just a really neat atmosphere. So I went back to college, changed my major, had to stay an extra year, but decided to do pre-dental, graduated, went on to dental school at Florida still, and go Gators. And then I went off to orthodontic school at University of Rochester, Eastman Dental Center, just where my dad did, and did my residency there, and then I moved back to Florida and started practice with my dad. It was the summer of 2000, and settled in Vero Beach. And one of the most important things that we really like patients and parents and dentists to know is that it's very important to bring your child in early. I know most parents think, oh, they still have baby teeth, let's wait for the baby teeth to fall out and then I'll take them to the orthodontist. But actually, the American Association of Orthodontics recommends age 7 is the magic number for bringing your child in, even though they have lots of baby teeth. And the reason why is because there's a lot of problems that can be developing that if we catch early enough and maybe do some early braces, we can really alleviate a lot of the problems and not have to do any extractions when they're older and just make it so much easier for them. So this is an example of, this is a 9-year-old girl who came in, and this is her x-ray, and you can see she still has baby teeth in her mouth, these little ones, all these baby teeth. These are her permanent teeth developing, but by looking at this x-ray, you can see on the bottom, the permanent teeth are coming up, and there's pretty much space for everything. This is a little crowded out, this is a little crowded out, but they all have somewhere to go. But on the top, this cuspid's coming down, it has nowhere to go. This is a permanent tooth all they're already in. This is a permanent developing, and that's a permanent. So these 3 teeth have to fit in between this little space here. And same on this side. 3 permanents have to fit in between here and here, and as you tell, there is absolutely no room. So what will happen if she keeps going like this, these cuspids will probably get pushed over behind these permanent teeth. They can get stuck, where later an oral surgeon will have to go up and get them, which is not fun for the parent or the patient. Or they can pop out the front of the gums or back behind all the teeth, and it just makes it very difficult to get them in later. So what we did for her is we started early braces or phase 1 treatment. You put braces on the permanent teeth, which are the front 4, top and bottom, and the back molars. Then you run wires with some coil spring on the sides to actually give us width, give us room front to back. Sometimes you do put a little expander in the roof of the mouth. Some people call them butterflies. It gives you just a little more width so we can actually make room for all these teeth so that they have somewhere to come in and go and they don't get stuck or have to be extracted. And then this is the little girl's x-ray when we were done with phase 1 treatment, which I think took about 14 months. Usually phase 1's about 12 months, 12 to 14, 15 months, somewhere in there. Took her braces off, we put a space maintainer in to hold all the space we made, but most importantly, she now has her permanent teeth in, and you can see they all had somewhere to go. They're all lined up very nicely. And then once they're fully done coming in, like this still has a little way to go, her second molars are coming in, then she may go into phase 2, which are braces on everything, to really make them straight and most importantly align the bite and make them all fit. But the most important thing was we made the room that she needed by doing braces early. And if she would have waited, she may have had to have permanent teeth extracted, or she could have had oral surgery if the cuspids would have gotten stuck in the roof of her mouth.
As you can tell, orthodontic treatment has come a long way from years ago, especially in the technology factor, but we strive to balance the high tech with the high touch. We pride ourselves on the quality of our treatment and on quality of customer service. So we truly care about our patients and their families, and we care about our community, and we care about each other. So our motto at Wemmer Family Orthodontics is making a difference, one smile at a time.